Dr. Howard Koh, Assistant Secretary for Health for the U.S. Department of Health and Human Services. And I'm delighted to welcome you again to the 19th International AIDS Conference in Washington, D.C., the largest AIDS conference in the world. And today I'm thrilled to have my friend and colleague Dr. Kevin Fenton here. Dr. Fenton is a universally respected global leader in public health, and he has a very important role at the Centers for Disease Control and Prevention as the Director of the National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention. Welcome, Kevin.
Thank you. Great to be here.
Kevin, you've given many important presentations at this conference. One of them is about the key theme of high-impact prevention. Can you tell us exactly what that means?
Sure. Well, the National HIV/AIDS Strategy really sets a vision for change for HIV in the United States, in which we're going to be focused on reducing incidence, improving quality to care, as well as reducing health disparities. And the high-impact approach is CDC's strategy for implementing the National HIV/AIDS Strategy by looking at the prevention toolkit, which is now fantastically developed with new biomedical and behavioral approaches and structural approaches, but also says how do we select the right interventions for the right populations, implement them with quality and impact to make a real difference with the HIV epidemic here at home.
Sounds great. Tell us more about what federal grantees and federal staff should know about high-impact prevention.
Well, first of all, I think our grantees must be excited that we are now having a very clear approach to implementation and holding ourselves accountable for selecting interventions, for looking at the effectiveness and cost effectiveness of interventions, for having new conversations about coverage, scale, and impact. It means that local grantees can begin a discussion on prioritization of their interventions. And then finally, the high impact prevention brings new tools to monitoring and holding accountable each other of what we're doing and hoping to achieve at the local level.
You had another presentation on the Black HIV epidemic, and tell us just a couple takeaway points on that.
That's right. As you know, there are communities in the United States which are disproportionately affected by HIV. Gay and bisexual men of all races, Latinos and Hispanics, and of course African Americans. And we know that African Americans account for about 13% of the US population, but nearly half of all new infections which are occurring. And this disparity is both severe for men and for women. It's not the color of our skin as a community that puts us at risk, but often it's the social and structural realities within which we're living. Poverty, poor access to healthcare services, poor educational opportunities and employment opportunities. So as we're thinking about addressing the epidemic, we have to think about both individual approaches as well as integrating those social and structural interventions. And that's what this conference has been about.
Exciting. Tell us your vision, Kevin, of what this means for the future of the epidemic.
Ultimately, we're looking at further driving down HIV incidence in the United States and really tackling the tremendous problem we have in the US with health inequities. Too many persons of color, too many gay and bisexual men in the United States are disproportionately affected by this epidemic. We can and we must do better.
Kevin, thanks so much. That's very, very powerful, and thanks for all you're doing for us.
Great, thank you so much.
So I'm Dr. Howard Koh from the International AIDS Conference in Washington, D.C.